Hi, my name is Shane, and today I'm going to present some modalities for flexibility. The first one we're going to use is a foam rolling technique that will help with alleviating tissue adhesions and mobilizing the tissue. Then we will cover dynamic stretches, which will move the body through the range of motion that will probably most likely be experienced in the exercise or athletic event. Then we will end our training with static stretching, which will help restore muscle length and possibly increase flexibility.
To start the workout, we'll use self-myofascial release by using a foam roller. This will help reduce tissue restrictions and mobilize tissue that will be used in the subsequent workout or athletic event. Each roll will be conducted along soft tissue surfaces for 30 seconds to a minute, stopping at points that are tight or feel restricted. We will be rolling out the calves, hamstrings, quadriceps, latissimus dorsi, and the pectoralis major. To start the dynamic warm-up, the high knee hug will be used. The athlete will maintain an erect posture, flex the hip, and draw the same leg in towards the torso. It is important to note that the torso should not flex forward and that the leg is brought to the torso. This will be repeated successively and alternating legs for 15 to 20 yards or for 1 minute. Next will be the quad pull. The athlete will flex the knee, drawing the ankle towards their buttocks. They will give a slight pull on the ankle, stretching the quadricep, and repeating on the alternate side. This will be done for 15 to 20 yards or for 1 minute. Next is the Frankenstein. Frankenstein will be hip flexion while maintaining knee extension. Important to note with this exercise is that torso again remains upright and does not flex forward as the hip flexes. This will be done for 15 to 20 yards or for 1 minute. The last exercise in the dynamic warm-up will be the inchworm. The athlete will stand in an erect posture with feet shoulder-width apart. They will hinge at the hips, reaching their hands towards the ground, then walking their hands out into the push-up position. Once there, they will walk their feet towards their hands and reverse the action and extend their hips to stand fully erect again. This will be repeated for 5 to 8 times. To stretch the hamstrings, an active isolated stretch will be utilized. A strap will be placed around the foot, the knee will be extended, and the hip will be flexed towards the torso. As the athlete raises their leg, they will reach a stretch barrier where they start to feel stretch. At that point, the quadricep should be contracted fully for 2 to 3 seconds, then relaxed, and the leg pulled into a greater range of flexion. This will be repeated 6 to 8 times to increase flexibility around the hip. The active isolated stretch for the quadricep will be used next. A strap will be placed around the ankle. The athlete will be in a prone position. They're going to pull the strap back, flexing their knee, bringing their ankle towards their buttocks. As a stretch is felt in the quadricep, the athlete will stop, contract the glute and the hamstring muscle, hold for 2 to 3 seconds, release, and pull the knee further into flexion. This will be repeated 6 to 8 times. For the upper body, a PNF chest stretch will be utilized. The athlete will sit on the ground, horizontally abduct their arms to 90 degrees, and flex their elbows to 90 degrees. Partner will support their arms and help the athlete stretch. This will be done by moving the athlete into the stretch barrier where some resistance is felt. Then the athlete will use about 20% contraction to counteract their partner's pull. This contraction will be held anywhere from 5 to 15 seconds, then released and pulled back even further in order to gain a deeper stretch in the chest. This can be repeated 6 to 8 times. Another upper body static stretch is a PNF stretch for the back. The athlete will sit on the ground, leaning against the ball, raising their arms overhead. The partner will then grab each arm of the athlete and slowly pull them up and away, creating a stretch in latissimus dorsi and tricep. Once the stretch barrier is reached, the athlete will actively contract, pulling the arms back towards the body. This contraction will be held for 5 to 15 seconds, then released, and the partner will pull the athlete into a greater range of motion. This will be repeated 6 to 8 times.
My name is Delano Davis, and I'm going to instruct the core exercises. Core is important because it helps to maintain balance and posture in physical activities, and it also is important to transfer energy from the legs through the body to the arms. The first exercise we're going to be doing is a core flexion exercise. This is the frog legs. So what you want to do is get flat on your back. You want to flex the hips to about 90 degrees and flex the knees to about 90 degrees, reaching towards your heels of the feet. And what you want to do is contract the anterior core. Contract until you get your hands to about past your heels, and then relax, and then contract again. My second core exercise is the back extensions. What you want to do is lay on your stomach in the prone position. You want to reach forward with your hands, and what you actually do to initiate the movement is push your hips towards the ground, allowing your legs and your upper body to come up, and repeat. For my core rotation exercise, I chose the Russian twist. And with this exercise, what you want to do is get on your glutes. Once you're on your glutes, you should put your feet in the air, and also your back is up. Keeping your back straight, what you want to do is find a balance. Once you find that balance, what you're going to do is you're going to rotate the core left and right, touching the ground with your hands as you rotate, and you will do this repeatedly. For my anti-rotation core exercise, what I'm going to do is the pile-off press. With this exercise, what you're going to do to get in the right position, first you're going to attach a band to the machine. You're going to ensure that your inner shoulder is facing the machine. And what you're going to do, you're going to take a split knee stance. Make sure that the inner knee is down and the outer knee is up. Both knees are 90 degrees. You're going to take the band and you're going to pull it towards your sternum, and then you're going to push away from the sternum. You're going to hold for a slight second, and then you're going to pull your arms back to your sternum, repeating this action. And the purpose of this exercise is, as you do the movement, you're going to prevent any rotational force by keeping the core tight. For my glute activation exercise, I chose the glute bridge. In this exercise, what you want to do is lay flat on your back. You want to put your hands at your side, bend your knees, and put your feet flat on the ground. What you're going to do is initiate the movement from your hips, pressing it upwards, and creating a bridge from your shoulder to your hips to your knee. And this action is repeated.
My name is Anand Suthiwong, and I'll be going over upper body. The exercise today is to increase your overall strength, and I'll be covering 4 different types of exercises: the vertical push, vertical pull, as well as horizontal push and horizontal pull.
First exercise is a horizontal pull, an incline dumbbell row with neutral grip. Start by putting a bench in an inclined position and lean your chest on the bench, making sure your chin is above the top of the bench. With weights in hand and wrists in a neutral position, pinch your scapulars together by bringing your shoulders up, and bring the dumbbells up towards your sides using your elbows, and back down. This works on your latissimus dorsi, trapezius, and your rhomboids major and minor. Next exercise is the vertical push. standing military barbell press. Start with the bar at shoulder width apart. Grab the bar with an overhand grip wider than shoulder width. Take the barbell off the rack and stand with your legs shoulder width apart. With a smooth motion, lift the weight over your head and lock out your elbows and back down past your chin. This works out on your deltoids, bicep, brachii, triceps, and serratus. Next exercise is the vertical pull, the pull-up. Start by grabbing onto a straight bar, wider than shoulder width apart, with an outward grip. Without jerking or moving your body, by engaging your core, pull yourself up till your chin reaches the bar, and back down to where your arms are in a locked out position and shoulders dropped. This works out on your bicep, trapezius, rhomboid, teres major, and latissimus dorsi. Next exercise is the horizontal push, the parallel bar dip. Start by placing your hands on the parallel bar shoulder width apart. Hold your weight on the median portion of your hands. In a smooth motion, bend your elbows till your humerus is 90 degrees or less, and then bring yourself back up. This works on the long, lateral, and medial head of the tricep, the deltoids anterior, and pectorals major.
Hi, my name is Kyle Ruth. I'm going to go over 4 exercises for the lower body, 2 hip dominant, 2 knee dominant. These exercises are designed to strengthen the muscles in the lower body and to reduce injury. This exercise is a Romanian deadlift. The muscles worked here are the muscles of the posterior chain, the hamstrings, glutes, and lower back. To start the movement, he's going to start with a slight bend in the knees in a standing position. He's going to hinge back at his hips, reaching the bar down, keeping his legs in the same bent position as they started. He's going to go until he feels a slight stretch in the hamstrings and raise back up, keeping a big chest. He's going to keep his back straight as well. This exercise is known as a wall sit. He's going to start with his scapulas against the wall and his feet about a foot away from the wall. He's then going to bend at the knees, keeping 90 degrees in the ankles, knees, and hips. This is an isometric exercise made to strengthen the quads, hamstrings, and glutes. This exercise is known as a split squat. For this, you can use a kettlebell or a dumbbell. The starting position, he will start kneeling, keeping 90 degrees in his front leg and his back leg, as well as an erect spine. From there, he will stand up, keeping his erect spine, and initiate the movement by bending at the knees downward. For this, he will keep a positive shin angle. This exercise is known as dumbbell step-ups. For starting position, he is going to stand in front of the box, bring his leg up, and place his full foot on the box as if he is stepping on a stair. He is then going to drive through that foot and kick up his opposite leg as if he is stepping on another stair, all while keeping an erect spine. This is almost mimicking the running motion without your arms. He will then step back down, back to the original starting position. By doing this, he initiates the constant flexion and extension of the hip flexors.